Do you know just how many lives are saved every year by vaccines? According to an article written by Jonathan Pitt and Julie Harag in 2018, vaccinations save 2 to 3 million lives annually. Considering that we're in the midst of a global pandemic due to COVID-19, now is a more important time than ever to understand the importance and necessity of being vaccinated. Although I myself am squeamish when it comes to needles, I understand that the brief discomfort caused by a needle prick is worth keeping myself and those I care about healthy, and I've done extensive research into why vaccines are absolutely necessary to keep us all in good health. Despite what the anti-vax movement may have you believe, vaccinations are completely safe and actually work to keep you safe. First, I'll give an explanation as to how vaccinations work and the clinical trial process which they go through before even reaching the market. Next, I'll explain how important it is for you to get vaccinated and the reasons you should do so. Finally, I'll address some of the common viewpoints expressed by the anti-vaccination or anti-vax movement and dispel some common myths about vaccines. So, before we discuss the importance of being vaccinated, we should understand how they work. Understanding how vaccinations work and the testing process that they go through before even reaching the public can work to dispel some common myths about vaccines being unsafe. According to a 2018 article for the Medical Writing Journal, vaccines work through the use of antigens, which are correlated with specific pathogens. These antigens, when put into your body, work to activate both your innate and your adaptive immunity. Put in the simplest terms, innate immunity uses our body's natural defenses that we already have, like white blood cells, for example, and adaptive immunity helps your body build up defenses to certain diseases. Vaccinations engage both of these immune responses, which works to create an immunological memory, which will help keep you safe from a disease if you are exposed even years later. Vaccinations also go through a rigorous clinical trial process before reaching the public. According to an article written by Helen Mao and Shibai Chow for the Current Applications of Pharmaceutical Biotechnology journal, vaccines go through 3 phases of clinical trial. This is a direct quote from Mao and Chow. Open quote, Phase 1 clinical trial is to test the initial safety and tolerability of the candidate vaccine. Phase 2 clinical trial tests the safety, immunogenicity, and dose ranges. And Phase 3 clinical trials are for additional safety data, immunogenicity, and efficacy. The rigor with which vaccines are tested speaks to the caution that scientists take before testing vaccines on the population. Now that we understand how vaccines work and the rigor with which they are tested, I'll go into the reasons that you should be vaccinated. So, why should you get vaccinated? Being vaccinated will help you protect yourself and others. Although it's obvious, vaccinations help to prevent diseases that have previously plagued our population. In fact, some vaccinations are so successful that these diseases are eliminated entirely. According to a 2018 article for the Medical Writing Journal, smallpox was completely eliminated following a worldwide vaccine campaign in the 1980s. Considering that we're in the midst of a global pandemic with COVID-19 and there are currently vaccinations for it in development, if a large chunk of the population chooses to get vaccinated, just like we did in the 80s with smallpox, we could eliminate COVID-19 entirely and never have to face something like this again. The more people are vaccinated, the more likely we are to develop what's called herd immunity. According to an article written by Nicola P. Klein for U.S. News, herd immunity is developed when enough people are vaccinated out of the population that the significant chance of you getting a disease lessens significantly. Some diseases require higher rates of vaccination for herd immunity to develop. Measles, for example, requires at least 92% of the population to be vaccinated for herd immunity to develop because it's so contagious. The more out of the population are vaccinated, the more likely we are to be safe from a disease, even if not everyone is vaccinated. That's how herd immunity works. Now, I'll address some of the claims made by the anti-vax movement. Although the anti-vax movement has gained significant traction within the last decade or so, often their claims are not backed up with facts. Why are parents choosing not to vaccinate their children? According to an article written by Shefra McKee and Kristen Bohannon for the Journal of Pediatric Pharmacology and Therapeutics in 2016, parents cite 4 different reasons for not getting their children vaccinated. religion, personal or philosophical beliefs, worries about safety, and lack of information. McKee and Bohannon assert that safety is the greatest concern cited by many parents. However, it's been made clear that many safety concerns about vaccines are either completely untrue or not correlated to vaccination at all. Autism, for example, is one of the most commonly cited fears of parents in not getting their children vaccinated. However, according to Stacy Colino in an article for U.S. News in 2017, the journal which originally published the research claiming that autism and vaccines were linked retracted the article entirely in 2010. In fact, 17 different separate studies have concluded since then that there is no link between autism and vaccination at all. Some parents also worry that vaccinations could be linked to rising rates of asthma and allergies in young children, according to Colino. However, it is unknown what causes allergies and asthma in small children, but there is no evidence that it is between vaccines. Some parents also worry that too many vaccines at once could cause an overload of the immune system, according to McKee and Bohannon. However, Colino asserts that not only can children and infants handle this, it will actually make their immune system stronger. According to McKee and Bohannon, the way to work through these common misconceptions is for parents to have trust in their healthcare provider. To conclude, today we have talked about how vaccines work, the extent to which they are tested, the importance of being vaccinated, the viewpoints of the anti-vax system, and why most of those viewpoints are untrue. Remember how I told you 2 to 3 million lives are saved each year by vaccines? That number will increase with every person who chooses to get vaccinated and chooses to get their children vaccinated as well. Remember, vaccinations help keep you and others safe, and they're easy to get. If you are not vaccinated, I urge you now to do so. If you know someone who is anti-vaccine, have a serious discussion with them about what I've told you today. And remember that vaccinations will help keep us all safe and healthy. Thank you.